All right, so right now we're gonna go over something called the joint by joint theory. And it's a very cool way of breaking down the body and explaining to you just how incredible this human vessel actually is, all right? So each joint has a specific job. It has a specific range of motion, a duty per se. So the ankle joint is designed for mobility. It has a ton of range of motion. It flexes, it extends, it dorsiflexes, it internally rotates, externally rotates, inverts, everts. It does a ton. It is designed to do a lot of things. And if it's not available, it will look elsewhere for that mobility. We'll get back to that in a second. The knee joint right above it is a stable joint. Some would even call it a dumb joint. Now I won't go that far, but it is in fact kind of slave to the ankle and the hip. It's not really designed for a lot of mobility like the ankle. It flexes and extends. It has some circular motion, right? You can do some things with it, but it's really designed as a stable joint, all right? Let's go up the chain to the hip, a ball and socket joint. Now this hip is once again designed for a lot of mobility. It has a ton of potential range of motion, and if you don't use it, right, it will look elsewhere below or above for more mobility. So let's start at the ankle again. Mobile, stable at the knee, mobile at the hip. Let's keep going up the chain to the lumbar spine. The lumbar spine is another stable joint, right? It's not designed for a lot of mobility. And this is why we see people with low back pain that usually have a lack of mobility at the hip, okay? Let's keep going up the chain. The upper back or T-spine area. Once again, more of a joint that requires mobility, right? It makes sense because we have a mobile hip, a stable lumbar spine, and we have to have that opposite at the top, the thoracic spine, mobile, right? Shoulder, mobile. Neck, stable, right? We go all the way down to the elbow joint, more of a stable joint. Wrist, mobile joint. So if you see, every joint has a job to do, all right? So let's get into some common areas of pain real quick and how we deal with pain, right? So most commonly we hear about knee pain, low back pain, shoulder pain, neck pain. So if someone comes into me with knee pain and it wasn't a traumatic accident, not a car accident or a fall, or they hit it on a table, there was no direct trauma to the knee, then that's not really where the problem is. The symptom is at the knee, but we don't ever deal. The problem is rarely, right, where the symptom is. So I would say we look above and below the joint that has pain. So if you have knee pain, I'm gonna look for lack of mobility at the ankle, below the site of pain, and I'm gonna look for lack of mobility at the joint above the site of pain, which is the joint that needs more mobility. So usually, not always, but if we can get more mobility at the ankle and the hip, you'll find that the knee, in fact, will feel better. And the same thing for the lower back. So lower back pain, I look at the hip and I look at the upper back. If I gain more mobility to upper back and gain more mobility to hip, you'll find magically that the low back starts to feel better, right? So usually it's a combination of mobility, soft tissue quality, and strength, right? But what I'm getting at here today is that by looking at the human body, by mobile, stable, and understanding that the site of pain is rarely where the problem is, right? We have to look above and below the site of pain to get to the root cause of the problem most of the time, right? It's a simplified way of looking at it, but I call it surrounding the dragon. If you have shoulder pain, you better look at the upper back, right? Because if the upper back's not moving well, it will look elsewhere, right, for that mobility, all right? So always think about that. If you're dealing with pain, right, and this is what we're gonna teach you in the joint by joint mobility program, is to look at the body as that stable, mobile joint system and you're gonna know how to tackle your own pain. It's important you're empowered and educated, and when you're dealing with low back pain, instead of going to the site of pain, you're gonna look above and below it. Same thing with the knee, the shoulder, the neck, right? This is an awesome opportunity for you to learn anatomy, learn the human body, and know how to fix yourself so you don't have to go to the doctor. You don't have to go to the physical therapist. The goal here is to prevent injury from happening in the first place, but if there is a problem, which there will be, you'll know how to deal with it yourself, all right? We'll see you soon. I hope this helped, and get moving.